Hello, speech and debaters, extempers, and everybody else who's sick along with me. Welcome back to the half hour. As always, I'm sick Spencer.
And I'm YuYu, who is perfectly healthy and not sick.
And today, we're going to talk about healthcare. What a perfect time for this topic. I was just thinking about this, I'm sick. Talk about the healthcare system. Hopefully nobody else gets sick about this topic.
Spencer's
Wow,
still
what a
sick
pun.
because he can't afford healthcare in the American healthcare system.
No,
anyway.
Literally, we're trying to be a more casual pod now, trying to go down that route. Casual, professional kind of thing. I've been sick for the last week. Originally, we thought I had strep. I tested negative for that. And then on Friday, I woke up very lackadaisical. And I was like, what the hell? What is this? Right? And I was horrible. It was like, I couldn't get out of bed. I don't normally call into work. I don't believe in calling into work. I don't believe in skipping classes. I did both of those, and I asked for an extension. 3 things that I don't like to do. I did all of them. I got tested for COVID. I came back negative. And the joke that I've been saying is, what sick person comes back negative for COVID? There's something very weird about that. I've never tested positive for the vid once, so I think that's a good thing. And YuYu has joined along with me on that endeavor. So rah, go team. Anyway, let's not get sick about this topic anymore. And let's talk about healthcare. And YuYu, 2 things. National topic. This is a topic area. Okay. So it's very important to understand our healthcare system. Hey, this is why we've chosen this. This is a very good topic for coming up. Lot to discuss, a lot to decipher about what's going on with the healthcare system right now. Hasn't really been talked about that much. It's very quiet in the news. The topic area, I believe, is where it is entitlements in healthcare. You can really say that healthcare entitlements are pretty similar to what we're going to talk about anyway, because really when we're looking at healthcare, we're really looking at the system. And even if we're discussing a lot about entitlements, the healthcare system is going to play a pretty important role. So even if we avoid the discussion of the entitlement portion, we're really going to talk a lot more about, or it's going to really involve the system. So it's more important to understand the system rather than it is to maybe know more about the entitlement portion. The US system is incredibly complicated, and this kind of brings us to the second point. It's really not a controversial statement, because both Republicans and Democrats can agree our healthcare system sucks. It's really bad. And whether you are for or against the Affordable Care Act, we know that we need something to change. It's not a good system. And admittedly, I was a pretty big fan of Obama. That's my statement out there. But really, when you look at the effects of the Affordable Care Act, it's only made the problem it only really made the problem a little bit better, but it kind of complicated the process further and didn't really help to solve anything that it should have. So really, reasonably speaking, it's done good, but it has furthered the complication of our process.
Yeah, just expanding off of what Spencer has said, these next few episodes are probably going to be covering topic areas that you'll probably encounter at nationals, especially in both international and domestic extent. We'll try to vary between them. Hence why this episode is about the US healthcare system, even though we're going to talk about other countries' healthcare system. But we think it's going to be a good example for all of you to kind of just know about and take into account of that the United States healthcare system is not the norm, especially in the international community. Just with the way that we set up the system is very complicated and weird in terms of how other countries have set up their healthcare systems. And I think healthcare has been a fairly quiet issue, but it's not entirely buried underneath all of the news. I'm sure all of you have probably heard the meme where Obama came to speak at the White House and called President Biden Vice President Biden and all that stuff. That moment while that meme was the one that was popularized. But that moment of time was when Obama actually came to speak at the White House to talk about Biden's expansion of the Affordable Care Act and what he wanted to do. So quiet, but not really quiet. And especially with like kind of COVID fatigue, I would kind of understand why people don't want to like report on the healthcare system anymore. But it was like a pretty big issue, especially regarding like healthcare worker rights or like yeah healthcare workers rights, healthcare workers pay, and also just like the whole fiasco when COVID hit and we didn't have enough hospital beds. We couldn't like deal with all of the influx of patients and COVID patients, especially along with treating COVID patients. We also couldn't deal with the fact that like people who didn't have COVID but still needed medical attention weren't getting the attention that they needed. And so there's just a lot of complications with how kind of the healthcare industry affects healthcare in the United States generally. And so we're going to be diving into like a little bit of that. We're probably going to be scraping the surface since this is kind of like a big topic area, but we'll kind of like limit it down to healthcare and like insurance policies and how like our country and other countries are dealing with that. So if there's nothing else that you want to add to that, Spencer, I'll let you get started.
Yeah, the big thing I think I'm going to say before we dive into my part, this is very complicated. And let's just make a fair statement. I don't think either of us is going to get everything right. There's just no way. This like I don't think a single person in the US can get this all right. Even like somebody that might be an expert around this area, I don't personally feel as a citizen of the US could really fully understand this system. It's very, very complex. And it involves a lot more actors than most other nations. Other nations have done a very good job of like limiting the number of actors that exist. The US is not that way. And that's kind of why it is a good topic nonetheless. Healthcare will always be a big topic. I think genuinely speaking, from most countries, it's always been a big topic. It always will continue to be a big topic. And because health is a very vital, important part to people's life. So let's just put it out in the clear. We're not going to get everything right. We'll do our absolute best. I think for the most part, we're going to do a pretty good job. But if we get some things wrong, bear with us. There's no way this is going to be perfect. Okay. So let's begin. And kind of the way that I'm going to do this segment is I've been taking a perverse incentives class and we did a whole section on healthcare. And this segment, we discussed really more of like looking at other countries' healthcare systems. And the reason why we want to do that is because we want to make a decision that might be good for the US in the future. And as we're going to see with the Extemp question that we have today, it's really good to understand a variety of different healthcare systems to figure out where the US should go next and really what it could be in the US. Now, truthfully, the best way for the US to go is to look more so down the lines of let's compare and contrast a variety of different healthcare systems and come up with something that best suits our state or our country's intuition, okay, our country's politics, and within obviously our capitalist system. Okay? We need something that works well. Everything is going to have a consequence. And that's one of the reasons why it's good to look at a variety of different ways. So today we're going to do that. And then after I go through it and explain all of these, what we're going to do is we're going to explain what the US's system is, kind of in a nutshell. And then YuYu is going to go through and explain a little bit about the Affordable Care Act and then some other things. So I will make a pretty important note. Obviously, in 2008, healthcare was a very contentious topic for the American presidency. At the time, the US was ranked 37th in the world in fairness and equality in healthcare. Now, not sure where we stand today. It's either very similar or likely worse, because while I would argue the Affordable Care Act has done some things that have been good for it, the truth is we really haven't gotten much better since. And admittedly, some other countries across the globe have, in fact, bettered healthcare systems. So I wouldn't be shocked to see if we were either 37th or lower when we look at healthcare in terms of that statistic. Maybe you can look that up while I go through and explain these other systems. So let's go ahead and start off with Great Britain. And their system is government run healthcare. This is a socialist system of healthcare. The government does it. The government has your healthcare system. It's called NHS, and pretty much everybody at some point in time in their life will end up using this system in Great Britain. Great Britain has a higher life expectancy and a lower infant mortality rate than that of the United States. There's no premiums that you have to pay. There's no co-pays. Instead, the British just pay the system through their regular tax money. And yes, it does mean that there are some higher taxes in comparison to the United States. However, most people in Britain are very happy with their system of healthcare. The video that I will link in the description has a Washington Post reporter who traveled to these different countries to understand this system. And people in Britain do not want a US ran healthcare system. It's just not an effective form, especially when they've been used to this system for their entire life, and it has been, in fact, pretty beneficial. So the pros and the cons, we'll talk about them for all of these. The biggest pro with Great Britain is that there is a strong incentive to keep people healthy, right? And the reason why is if the hospital or the surgery, as they call it, doesn't continue to keep people healthy, that means that they will be less funded by the government, right? It is possible that the government can, in fact, put these areas out of business. So there is actually an incentive to keep people healthy. And when we talk about competition within Britain, they really talk about competing for the health of people, right? Competing for keeping people alive rather than competing for money, which is something that is seen in the United States. The biggest con is that government orientation does in fact lose some simple things. So, and the big one tends to come with like replacement surgery, right? If I have to go and I have to get a hip replacement or I need a heart replacement, one of the biggest downfalls to government orientation or government ran healthcare is that you're not as easily going to be able to get a replacement for a hip versus a replacement for a heart. It's probably better to do that in a place that does not have complete government run healthcare. It's just easier in other countries. It is a pretty significant downfall for there. Otherwise, it's a pretty simple system, and it's a great one to start with. Obviously, this is not something that can be easily obtained in the U.S. We don't have a socialist system. We are still functioning pretty much on an idea of capitalism, so it's not something that can be very well obtained in the U.S. Next, let's turn to Japan, and we know Japan as everybody there is pretty old, and that's maybe a terrible stereotype, but there is a long life expectancy in Japan. And this is because of its system. Its system is everyone has access or has healthcare access through work or other means. If it's through work, if an employee quits their job or is fired, they actually get to keep their healthcare access. So you're compared to the US, if you have healthcare through your job and you quit, you no longer have healthcare. It is very different. So if I was to lose my job in Japan and I had healthcare through work, I am likely to still have my healthcare access. Actually, I have to have my healthcare access. Japan, as noted earlier, does have the longest life expectancy in the world and the lowest infant mortality rate in the world. And this is because its system is pretty good. In addition, the prices are very reasonable. The Japanese health ministry actually sets standards for prices of medicine and specific things that you need to get done, right? Prices are all the same. It's pretty strict. For example, in 2008, an MRI was $98. It's about $300 now when you look at the comparison. Reasonably speaking, in the United States, it's not that cheap. It's maybe at least 5 times the cost for an MRI if you're lucky. and with your insurance in the US. Doctors cannot charge what they want. And that is honestly a very good thing. Most of the doctors are very appreciative of that in Japan, that they can be able to help their patient. It's more of a patient focused, we're going to help you, we're going to take care of you, and we're going to improve your health kind of system. So looking at it, the pros, there's also little wait time. It's about, some patients see about 3 to 5 minutes before they are in and visiting the doctor. So you don't have to wait in the waiting room for very long. And prices are universally the same. That is very good for the average consumer. The con, though, is that most hospitals do, in fact, hold a deficit. And it was about 50% of hospitals holding a deficit in 2008. So usually to be able to combat that, that is how prices do rise in Japan. So if, in order to get hospitals out of that deficit, you do have to raise the prices of specific like MRIs or what drug prices are, etc. Next, let's turn to Germany. Germany's system is government must provide systems to help with healthcare access. Rich people do have the option to opt out of the program. About 90% of the people, though, in Germany are on its system. So you do have very good, adequate healthcare access, and it is typically provided by the government. That 10% is clearly the rich pushing themselves out. And Germany and the US are pretty similar in a lot of ways when you look at its waiting times, etc. So it's not as fast, but you're clearly going to be able to see the doctor and get what you need to get done. The way the system is designed is that the rich pay for the poor. And we hear a lot about that in the United States, right? Especially when it comes to taxes, where the rich should be paying their fair share. That's the best way to put it, right? So this is the design of the system. The rich pays for the poor. When you do go into the hospital in Germany, you pay a copay of 10 euros or about $15, which is paid once per 3 months. Hey, so if I don't visit the doctor in 3 months, I pay the copay. If I don't visit the doctor in 6 months, I don't have to obviously pay that copay. But if I visit the doctor every other week, I only have to pay once in that 3-month period. So you don't have to pay a copay every time you go in. It's just once per 3 months that you have to go in, right? The pro is that the poor have access to equal health care and are helped by the rich, which is a very good thing. Everybody has access to healthcare. Nobody goes bankrupt because of the system, etc. The cons, hospitals and doctors feel as if they aren't being paid enough. And that is a problem. It is important to note that like doctors do put themselves at risk. And I would argue that in some ways that they do deserve a good pay. So if this is a situation that is happening, then that is a significant downfall to the system. And this is partly because they really can't raise prices either in Germany. And once again, that's because the government's pretty involved with the healthcare system in Germany. Next, let's turn to Taiwan. And it's really interesting to learn about Taiwan's story. Taiwan's system was one of the worst in the late 80s. It's actually worse than the US's system, which some people would say is pretty impressive. When they changed, they looked into the US's system, but chose not to do it. And their reasoning is because the US healthcare is not a system, it's a market. And I think that's a really good term to use for describing this episode. We are a market, we are not a system. So really when they went to look through a variety of options, they realized that Japan and Germany's healthcare systems work very well. They analyzed a number of different countries and a number of different systems, and they developed a one government insurer and the rich cannot opt out system. Okay, so literally Japan and Germany combined. And one of the coolest parts about the system that I think most Americans would absolutely love is that everybody has a doctor card. And what this is you have preloaded information on the card and you don't need to fill out the paperwork every time you visit the doctor. You take the card, the doctor swipes it, and the first time you go in, you type in all the information, it's filled on there, and you only update what you need to. So you don't have to fill out all the paperwork, do all of that, like do all the typing shenanigans, etc. It's already preloaded. Don't waste your time. Just get in, visit the doctor, get out, right? And honestly, that is really an amazing thing. What Taiwan has done here is phenomenal. And one of the best parts about it, and the biggest pro, is that it's the lowest administrative costs in the world. Think about that. Compared to the US, it's not close. The US is about, I think it was in 2008, it was, if I recall from the video, it was either between like 15 to 22% of our GDP was going into healthcare. For Taiwan, it was 6%. That is amazing. Taiwan's system is very effective. The con at the time was still to be determined. It's likely that doctors are not paid as well, which is going to be a truth within a system that doesn't have a lot of administrative costs, and it's going to just be a direct result of that. Lastly, it's important to look at a country that is in fact very similar to the United States. And we have talked about this quite a bit when I started learning about this, and that was Switzerland. Switzerland it's very similar to the US. Its beliefs, what the people want. It used to have a very similar functioning healthcare system as that of the US, but they realized that there was a problem, and the system was not good. It was agreed upon by both sides of the aisle that we've got an issue. So the system has been changed to everyone buys insurance, but the government covers the poor. So once again, it was similar to the US at one point in time, but eventually they realized that healthcare is an entitlement and a basic human right. So Switzerland did end up going down this path. Companies still function in a normal capitalistic sense in Switzerland. They make a profit through supply costs and not drug prices. So they are still able to reap a third of the profit. And that is fantastic. They're able to develop some kind of capitalist system in which people can benefit from equal access to healthcare. The pro is that no one in Switzerland has gone bankrupt from healthcare. And I think that's pretty true for a lot of the stuff that we talked about. But I think when we're looking at a capitalist system of healthcare, that's a very good pro and fantastic to be seeing, and something that the US should really start drawing on and looking at and realizing, hey, this is pretty good. A con is that pressure still exists to raise the premiums. Switzerland is still the second highest premium in the world. So yeah, healthcare premiums being high is still pretty problematic, but reasonably speaking, this is a very good thing. When looking at all of these, we do have to ask ourselves which one is the best. And while I personally believe it's Switzerland, I think we were talking beforehand, you also believe that this was Switzerland. You might change your mind after hearing all of this. But clearly the US system is flawed for one reason. And that is there are too many institutions, which causes the system to be confusing. Not only do we have hospitals and insurance, but we also have a load of other health programs, such as disability and welfare programs, which causes it to be a complete mess. Additionally, in 2010, Obama signed the Affordable Care Act into law, which added another institution. The problem results from the healthcare market, not necessarily the healthcare system. So while we are a capitalist nation, the market has several structures that does make it confusing. Thus, it is imperative to find a way to make the market easier for consumers. And I know I had a long background segment here, but this is really important. And it's good for us to look at a variety of different systems out there, and realize, hey, we've got something that's really complicated and not effective, especially when we can cut administrative costs so significantly and have better outcomes with people's life expectancy and have have lower infant mortality rates, right? The fact that we spend so much on healthcare is actually a bad thing when compared to like Taiwan. So there's a way to make this effective and successful.
So yeah, our healthcare system compared to other countries not so great, and we'll get into that in this section. But I think like I just want to build off of what Spencer has said so far, but this time we're mainly going to focus on the United States and what the US has been doing to try to fix this kind of system. And there were like a bunch of proposals to try to fix our healthcare system, namely by Bernie Sanders, who kind of started the Medicare for All wave of influence in the United States. And within that plan, if you'll recall back to the September topic in like, I don't even know, like maybe like 2020 or like 2019, it's been so long. That was the Medicare for All topic. I know some of you like, especially in Wyoming, didn't debate this, but for those of you like on the circuit that's maybe listening to this podcast, you'll probably remember what that was. But that was a plan that kind of promoted centralization of our healthcare industry so that it would be similar to the healthcare systems that Spencer have just talked about, in which your information is kind of like centralized and like stored in one single database, which would theoretically decrease like administrative costs and kind of just like costs that were wasted, or like money that was wasted because it wasn't like solely focused on providing healthcare for its citizens or quality healthcare at that. Okay, but that's just something to kind of like throw out there. The one that I'm going to be mostly focusing on and talking about in my section is the Affordable Care Act, right? So one of the biggest things I would say President Biden has done in office, besides like international policies and stuff like that, is how he's handling the Affordable Care Act, or otherwise known as Obamacare. They're the same thing. I'm probably going to use them interchangeably throughout this podcast, so just know I'm referring to the Affordable Care Act if I say Obamacare. But before I go into the details of what has been done and what the reactions were, I just want to clarify that the Affordable Care Act is not necessarily an insurance plan. It's just something that makes insurance cheaper and healthcare more accessible. So you're still operating within the healthcare market of the United States, but ACA mainly makes Medicaid like more affordable, or like ensures that you have access to insurance policy. But the main way that like they've decreased costs for people is through government subsidies that makes the premiums or just the general cost of having healthcare cheaper. So that include like things like co-pays and stuff like that. It also expands eligibility to insurance. So that just means that you can use Medicaid if you have a pre-existing condition. It also states that insurance companies can no longer deny service to people who have a pre-existing condition. So most insurance plans did not let you gain access to their benefits if you had a pre-existing condition, which then of course obviously excluded millions of Americans, because turns out pre-existing conditions are actually very common among like people in the population. So this is just like a gist of what the Affordable Care Act is, or Obamacare is. So if you want to look into the specifics, I would highly encourage you to do your own research. But anyway, let's get on to what has happened since the ACA's creation in March 2010, which is during President Obama's presidency. So the March 2021 stimulus bill expanded subsidies for Obamacare, which just means that the government paid for the cost of insurance for citizens who qualified. As a result, millions of people got to enroll into Obamacare plans that made it more accessible for them to get access to healthcare because it made it cheaper. However, these subsidies and programs that allowed low-income people to avoid premiums are kind of set to expire at the end of 2022, in which case they can no longer afford insurance anymore. The Biden administration, along with the Democrats' plan, was to make this permanent by including it in the Build Back Better legislation, which we now know was thwarted by Senator Joe Manchin. So that's not going to happen. And it's estimated that 14.4 million people is going to lose their healthcare coverage at the end of 2020 when those subsidies expire, basically. But even at this time, some states are fearful that Biden's goal to expand healthcare coverage will not be sustainable, and have worked, or these states have worked to incorporate Affordable Care Act like policies and legislation within their own state to help people who can't afford healthcare. So some of these states include Oregon, who's trying to help by creating a basic healthcare plan, which would help 55,000 citizens in Oregon gain access to healthcare. Kentucky is also another state that's looking to increase access for their citizens as well. Their plan would be sort of like a bridge between healthcare and losing, or like between having healthcare 1 second and then losing healthcare because those subsidies have expired. So if a person were part of that group that had to lose coverage, it could be made up for allowing them to get higher paying jobs rather than like excluding them from getting higher paying jobs. Yeah. So in Oregon, that was mainly a proposal done by Democrats to try to help lower income citizens or people who couldn't afford healthcare gain access to healthcare. And Kentucky is mainly done by the Republican Party, who is also focused on trying to help their lower income citizens gain more access to healthcare. However, Biden just proposed to fix the family glitch issue, which is a loophole in the Affordable Care Act that prevented many families from accessing Obamacare regardless of the subsidies. So this was during the time when there were memes about former President Obama coming to speak at the White House, like I just said, and calling Biden vice president. But mainly, former President Obama came to speak in support of this move by President Biden. So what the family glitch was as the simplest explanation possible, was that workers who had families could get health care for themselves or like health insurance for themselves through their job, but their job would not cover health insurance for the rest of their family, which either caused them to take the more expensive family plan or not insure their family at all, or do a mix of having their health insurance be covered by their job, but then having to buy like separate insurance to cover their family. So by fixing this glitch, it's reported that it would allow all members of the family to qualify for affordable health care. And it would mean that a million more, or like a little bit over a million more Americans would then have access to healthcare. To do this, Biden has also signed an executive order on the same day to expand healthcare access by strengthening the Affordable Care Act. How does it strengthen the Affordable Care Act? Well, the executive order doesn't give much detail into what the actual administrative process would look like, but the goals that were outlined was increasing state access to expand Medicare access and coverage. And some of the specifics of coverage include covering 1 year postpartum after pregnancy, because if you didn't know, just the mere action of giving birth and staying in the hospital to recover is very expensive and wasn't really covered by insurance companies. A little bit more on that in the later part. But in terms of specifics of how many states have an adopted expansion of the Affordable Care Act, which excludes people from being able to have affordable insurance, there were 12 states that haven't expanded it, and as a result, excluded their citizens from being able to access affordable. However, that being said, did these proposals actually work? The short answer is no, it didn't work because it really didn't solve the core issues of why our healthcare system is so bad in the first place. But other than that, the controversy surrounding kind of healthcare and the Affordable Care Act and things like that, there's just like a couple of takes. So first, some think that healthcare will be a big midterm election topic, mainly arguing that if something cannot be done to extend subsidies and ensure that Americans can access affordable healthcare, then it might become a failure of the Democrats, which would make them less appealing to vote for in the midterms. However, the other hot button issue is that Senate Democrats are working now to protect access to birth control under insurance through the ACA, which has become a big issue in light of the leaked document revealing the opinion that reverses Roe v. Wade and would get rid of women's rights and access to safe abortions. And so another part of that is because the Affordable Care Act or the expansion of the Affordable Care Act in the executive order that Biden signed included like coverage of women who are in postpartum or like a year after postpartum. This is kind of something that has been like a very hot button issue to kind of talk about, just generally speaking, with everything that is going on with the Roe v. Wade case. But then on the other hand of that, since this is not that episode, it does seem like Republicans are no longer on their kill Obamacare or kill the ACA train, which could be a good or a bad thing. Kind of the bad thing being that they probably stopped attacking the ACA because it's fairly popular now. So it really wouldn't make sense for their campaign if they wanted to get rid of the ACA, because then they would lose voters in that sense. However, Republicans still don't approve of government-ran healthcare and feels like the free market competition that is now our healthcare system should naturally kind of drive prices down and increase the quality of care because of competition happening within the market. So this is why they've kind of mainly been opponents of the Affordable Care Act, which means that like the government has been subsidizing these plans. And so it kind of like hinders the ability of these insurance companies to kind of compete with each other and drive down prices that way. But that is only like one view, and theoretically it makes sense, but like in reality we haven't actually seen it work that way. But honestly, the main issues that critics have with the expansion of the Affordable Care Act is that the healthcare system is something that has been a mess for a very long time and consistently excludes the people who need it the most. They feel that while the ACA can help to an extent, it doesn't solve the larger issue at play, that the American healthcare system has been broken for a very, very long time now, and other reforms or even radical change might be necessary to change that. And I think that concludes my section. There's like not much else I would add until we get to like the question that we have for today.
Absolutely. And, I think you bring into it actually a pretty important point. Yes, it is true. Republicans have kind of accepted the reality the Affordable Care Act is here to stay. And honestly, I don't really see that as a bad thing. I think Republicans are just done. It's there, right? But it does need to be noted that the healthcare system still sucks, right? And at the end of the day, as we kind of come to that conclusion there, it's clearly obvious that Republicans think this of some nature, right? Whether this is the competition that's there, right, that's causing this problem to be able to like naturally drive down prices, right? I mean, they're still high. And that's kind of why we're saying, look, this is a problem. And something has to be done. We don't have an effective system. It's the truth. So the question today is pretty good. It's kind of deep back in the Extemp Central catalog, but the question is, how can public health institutions regain the trust of the American people? And YuYu sounds like she's got a bunch of interesting things, so I'm going to shoot it on YuYu first.
Great. So yeah, approaching this question, first of all, it's super duper broad, even though I like very much like this question, just because it says like public health institutions, right? Like, what is a public health institution? What is it referring to specifically? Are we referring to the whole system, which like incorporates healthcare providers, insurance companies, pharmaceutical industry, hospitals, clinics, et cetera, et cetera? Me though, I don't really kind of like care about the specifics of what they mean by public health institution. I would just regard it as like, okay, it's talking about like the public health institution, public health industry within the United States. Let's just talk about that and like generalize it to that. So it makes your life easier, especially in like a 7-minute speech where you can't really talk about the specifics of each and every industry within like the public health institution, or like each and every public health institution is a better way to phrase it. So when approaching this question, I think you can use a couple of different avenues, but I have like a couple of thoughts in terms of like, how can public health institutions regain the trust of the American people? Mainly, I feel like through research and what I've read and also personal experience, that the American people don't trust healthcare or like health institutions because they feel like health institutions are not there to support them or actually really care about their health, or is there to provide what they need in order to feel like safe and also feel healthy at the same time. And that's just because insurance price of that super duper high, just because the cost of just going to the hospital and like staying for a night in the hospital means that your bill could shoot up to tens of thousands of dollars, which is absolutely insane. Other than that though, many Americans have gone bankrupt because of healthcare bills and bills that they've just like racked up from an accident or even just like going to the hospital. And many of those reasons has led to a disillusionment among the American people with the healthcare system and public health institutions as a result, because it feels like these public health institutions aren't actually there for them because they charge such exuberant prices. So a way to kind of regain trust is to kind of fix some of these problems of costs, but not necessarily like fix it from the surface where the government is like subsidizing for insurance plans so that it makes insurance more affordable to like be able to cover your bills, but kind of just like thinking back to whether or not healthcare is actually a priority, right? Because if it is like noticed or like considered a human right, then people are more likely to provide it like it is a human right rather than it is like a market economy type thing, which it really shouldn't be. Like I wrote a kind of like paper on this about how healthcare should actually be provided as a human right, because it's not something that all of us can control. Like we can't control when accidents happen. And from just like the nature of consumption, we also can't help it if we have pre-existing conditions or we have conditions that have developed into severe problems. So that's why we need healthcare to be affordable and to be accessible so that we are protected when it's there. And so like one of those ways to do that is by attacking it at its core. So Medicare for all is like something that you could talk about. You could also talk about other things like price controls on the pharmaceutical industry or antitrust law to kind of break up the monopoly that some insurance companies have in the public health institution or like in public health institutions and things like that. All of those are kind of like ideas that you could research on your own time and like toss around to think about, to talk about within this speech. So really, when it comes to like the 3 points, I don't think it's a problem of not having enough points to talk about, but it's a problem of really like limiting those points down or like narrowing those points down to actually get to the answer that you're going to say, because you still don't want them to kind of be like randomized in the sense that you're saying, oh, we should do Medicare for all and Affordable Care Act, because they're kind of like two different things that don't do the same thing. Like one works within the system, one works to radically change the system. And so thinking about it that way and really like fleshing out the narrative of what you think public health institutions should do to regain the trust of Americans is the biggest thing that you would have to consider when answering this question, I would say.
And it's really weird because as I kind of mentioned when we were looking at like the different governments and what they do, right? Each of the governments I listed, all their citizens have like love the system, right? There's no hatred for the solution, right? And that's what I think is really important about what Taiwan had observed about us is it's not a system, it's a market. And that's the real problem, right? I think that the reason why Americans don't have a lot of trust, and kind of driving back to what you said, is it's a market, right? And it's egregious prices that just don't make any sense, right? Like look at how everything is really broken down, right? You have to pay an exuberant cost for health insurance, right? And then the next thing you know is something unexpected could happen to you. And oh, wait, health insurance only covers some things and it doesn't cover this one, okay? Which means that you're going to be paying full price for this at the hospital, okay? And if you're going to be paying full price for this at the hospital, it's going to be an egregious charge already, right? So you have to find the plan that covers you the best based off of the things that you might have, unless if it doesn't cover that, right? Which all of a sudden might happen. System's a mess, right? And it's because it's a market that's really not designed to help the people, right? It is in itself one of the worst perverse incentives in the US. Here's a really good example. And this is something that shouldn't have a cost to it. Okay. One of the topics we discussed in this perverse incentives class was dementia. Okay. And in the US, dementia is the disease to pay to watch your loved ones die. You pay to watch your loved ones die. That's screwed up. That's flat out screwed up. That is not something that we should have in the US. We need a system that is not a market, right? And I think like that's the simple solution to this question, right? There's your thesis for your speech. The US should develop a system and avoid a market and talk about how the US is a market, right? Talk about the insurance companies, what goes on within them, right? Let's talk about the nomical hospital costs, right? Let's talk about drug prices. Those are like three very good points for an Extemp speech here. We're talking about we're like, don't get me wrong, I love a market. Market's great. I'm kind of capitalistic. I kind of have that point of view, but this is atrocious. The way it is very bad. And it's not very well controlled. It is just so many different institutions upon one another that has caused a utter chaotic mess. So the truth is the way to regain the trust is we need a system. We don't need a like we really should be naming this episode US healthcare market. Like that's really the name of what this episode should be, but system sounds better because it means you clicked on the video, right? Like the thing is, we have a market, we don't have a system. Fact. Okay. And I really think that's why we don't have trust in this system. We need something, well, we don't have trust in the market, but we really need something that is a system that works and is well established, right? And we can do it for less of the cost that what we are doing it for now. And I don't think Americans would be complaining about that. Certainly Republicans won't be because they're sick of this deficit thing. We need to come up with a system that's literally half the cost of what we spend now. Sorry, I'm passionate about this topic because there's a lot that comes into play with this. But I think the answer to this question, Yu, is we need a system. Let's stop playing the market game. We're done. Like nobody here wants a nobody here wants the high drug prices. Nobody here wants the high insurance prices to get all of those things that might affect your area. Nobody here wants the high hospital prices, right? And yes, there's something to be said for the doctors wanting to be paid well, right? Hospitals wanting to make money and people having jobs. There is something to be said about that because that is a drawback to potentially having a system in place is these things are going to be affected. It's a fact. But we really like Americans are pissed. This is not a system that works. And it's just time it's really time to develop something that is better on the books, can help the people and can just establish a successful system.
Yeah, I think there's a lot to be unpacked with kind of just like establishing a system in general, since we technically kind of don't really have one. It's there, it exists. It's just it doesn't operate as well as it should, nor does it actually treat people the way that they should be treated in terms of like providing healthcare. But if you do want to like argue for the market and argue kind of like how do we just fix the problems that do exist now without imposing such radical changes? I think a couple of steps to consider is to kind of just like, okay, well, one of the issues is that actually market incentives aren't driving prices down or down to the point where they are affordable. So maybe thinking of things like market regulation or like antitrust regulation as a way to decrease costs so that monopolies aren't happening, collusion isn't happening, and try to like decrease the kind of corruption that has been apparent in the healthcare system that we have, or like the healthcare market that we have, which would then promote like better competition, which would then actually try to decrease the prices because of that competition and actually allow people to compete with each other in that sense. And even then it would still follow the similar logic that like these companies can then like compete against each other to drive down the prices but also like increase the quality at the same time. But like other than that though, if you do want to go for the other option, which is just like maybe a little bit more radical than just proposing like surface level changes to our healthcare industry, like what you could do is like maybe argue for Medicare for all and kind of explore the intricacies within that. If you're a PFer that did the September topic, I'm sure you still have back files or like the analysis necessary to explain like the positives of the Medicare for All Act. But some of the things that you can like mention and bring up is just like how the Medicare for All Act actually centralizes healthcare to the extent that it actually gets rid of a lot of the waste of like administrative waste, because rather than like having to have time to transfer your information from a clinic to a hospital, and then if you move having to transfer that data, your own personal data, to another hospital and like waiting for that time, like all of that costs money, costs time, and has a lot of waste involved with it that it could be avoided if you just like centralize a system where everybody's information is like stored in one big database so that you no longer have to fill out another hospital form or like have to fill out another form when you go into the clinic that asks you what your name is, where you live, your insurance information, because hospitals and clinics would just have that under Medicare for All. And like Medicare for All also ensures that everybody can gain access to healthcare and ensure that like these people get the care that they need, get like care for their pre-existing condition, et cetera, which would then like change the way that our healthcare, I guess like industry is what I really want to call it, works. And I think like those are some pretty interesting answers that you could go for that kind of like ranges throughout the perspectives that you can have on the US healthcare system.
Yeah, once again, driving back to Taiwan, right? Have everything on a card, swipe it, just ask if there's anything that needs to be updated. How hard is that? Like that seems very easy, right? That there's just so much with what it is now. I do think, if I'm not mistaken, and could be, but if we were to implement like a Medicare for all, right? Not I'm gonna try not to advocate for that, because I want to kind of stay neutral on this. I don't want to push for one over the other, right? I do think that the end goal needs to be get rid of the market, establish a system kind of thing. That's like the end goal here. That's really something that needs to be said. But if I know my numbers right, establishing like a Medicare for all, universal healthcare kind of thing, we would in fact be saving a lot of money as the government. Like these systems are really designed to be better for that. Like you establish a universal healthcare, we should in theory be cutting quite a bit. At least half of what we spend now would probably go away from you. Might need to double check my numbers, but it will be a significant cut. And it would shock a lot of people to hear that, because it's kind of the truth, right? It's really one of those situations where we need to we really need to start looking outside of the US and realize, hey, what can we do to establish a system that's effective for the people here? And yes, we have a huge population. We don't have the same population that Germany does. We don't have the same population that Switzerland does, Japan does, Taiwan does, Great Britain does. I think we got a greater population than all five of them combined. The point is, we do need something that works. Hey, and like I said, I don't think this is a partisan thing. This is a what the heck are we doing? This is ridiculous, right? Because there are insurances out there that don't cover that one thing, right? And then when it doesn't cover that one thing, then the price of everything is through the roof, right? Great example is rabies is a shot that is not covered. If you live That is not covered by some insurances. If you live in an area where bats are likely, right? Which is a real thing, and maybe a story that I've been told before in a class, but and you don't have that specific insurance, it can turn into $8,000 a shot in the US per family member. If there is a bat in your house and it could potentially have rabies, that means that is your entire life savings, and you will not be able to pay for electricity, for housing, for literally anything. How do you know? We really need to figure something out. And I think that's kind of the point of this podcast is when we're talking about this at nationals, I think what we need to understand is, look, this is a problem. We've got to fix it. We're done. Hey, like it's no more toying around. Like, and honestly, I guess my personal opinion, because sometimes we do that, right? I mean, we do that a lot, right? But my personal opinion is I'm glad that Biden's trying to fix loopholes in the Affordable Care Act, but it's time to give it up. Like it really is. I think that we need to finally just let's scrap what we have. Let's start over. We really need something new, because what we have is not working, and it hasn't been for a while. It hasn't been for like it's really time to move on. I think it is time to move on from the Affordable Care Act. I think it's time to I think it's just time to establish a system that works.
Yep, systems that work. And I hope that all of you have gained some knowledge from this podcast episode in order to help your Extemp endeavors. So, that being said, I hope you get the one in the round. If you didn't, let us know how you did. Let us know how we did. If you have any questions, comments, or concerns, feel free to DM either me or Spencer on Instagram. We are available on our handles. But You can also follow us on our social media officially at the Half Hour Extemp podcast on both Twitter and Instagram. We do polls there. We might do a Q&A one day when I'm not busy with midterms or homework, but it will happen. So keep an eye out for that. Follow us there. Please, 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 so that you get updates and you can vote for the topic that's going to be talked about next. But with that, hit the subscribe button, ring the bell so that you don't miss early episodes that are posted on our YouTube page rather than rather than one clap. Thank you so much for supporting us. We love you all so much, and we hope that you have a great day, a great Extemp endeavor, and we'll see you next time.
Thank you all so much for watching, and until next time, we will see you all later.